Living with blindness. Losing the ability to see can be scary, but it doesn't warrant you to limit your ability to live in your life. To be considered legally blind, you have to meet two criteria. And what are these criteria? One, your visual acuity is 20/200, or your visual field is no more than 20 degrees. Are the different types of blindness. One, we have color blindness. Color blindness is the inability to perceive differences in various shades of colors, particularly the green and the red. These are colors that others can distinguish, but because one has color blindness, you cannot distinguish between green and red. And also, it is most often common in male and affects 8% of male and 1% in female. People who has this color blindness, they usually have normal vision, otherwise can function well properly. Talking about the risk factors associated with color blindness, we have having an eye disorder such as glaucoma and macular degeneration. We also have chronic alcoholism. We also have Alzheimer's disease, also Parkinson's disease, and some certain cancer such as leukemia. So now we're going to talk about some symptoms of color blindness. So if you're talking about symptoms of color blindness, we have difficulty, just as I've said previously, distinguishing between colors, then inability to see shades, tones of the same colors. These are symptoms that shows that one has color blindness. So now we're going to talk about how to diagnose color blindness. Seeing color is subjective. So for the doctor to be able to diagnose color blindness, he or she has to perform an eye examination, and one of that is pseudo-isochromatic plates or Ishihara plates. So these plates images are made of small colored dots that have numbers or symbols embedded within them. So now the doctor is going to ask the patient to read the numbers, and this can help the doctor to diagnose an eye color blindness.
So the second type of legal blindness is the night blindness. It is a difficulty in seeing under situations of decreased illumination. It can be generic or acquired, and the majority of people with night vision difficulties function well under normal lighting conditions. Symptoms of night blindness. The sole symptom of night blindness is difficulty seeing in the dark. Usually when people get inside a room and have not opened the lights and could not see anything, even just a shadow, it is a symptom already of night blindness. What are the treatment methods under night blindness? So night blindness is treated depending on the cost. So first is vitamin A deficiency. It is treated by giving vitamin A supplements to the patient. Another is myopia, in which the use of corrective glasses or lenses. Then next is glaucoma, in which they switch the glaucoma medicines that the patient use. And lastly is peripheral cataract, in which they undergo cataract surgeries to correct the night blindness.
Hearing loss is when your ability to hear is reduced. It makes it more difficult to hear speech and other sounds. Several types of hearing loss. First, the conductive hearing loss is when sound waves are blocked to the inner ear because of external ear or middle ear disorders. The disorders can often be corrected with little or no permanent hearing loss. Causes of conductive hearing loss. These include inflammation or obstruction to the middle or external ear, tumors, autosclerosis, or buildup of scar tissue on the ossicles. Signs and symptoms of conductive hearing loss. These include difficulty with the overall loudness of sound, but not the clarity, pain in one or both of the ears, sensation of pressure in one or both of the ears, difficulty or frustration with telephone conversation, foul odor coming from the ear, and a feeling that one's voice sounds lower or different.
There are several options exist to diagnose conductive hearing loss. First is otoscopy. This can rule out an injured eardrum, foreign bodies in the ear canal, and middle ear effusion. Second is through Weber test. During this test, a tuning fork is struck and placed on the crown of the head. A person with normal hearing sound should be able to perceive the sound equally in both ears. But for patients with conductive hearing loss, the sound wave travels to impaired ear. Next is tympanogram. This measures the mobility of the eardrum. This exam detects whether there is an increased pressure or a reduced pressure in the tympanic cavity, which localizes the cause of conductive hearing loss. And lastly, we have the pure tone audiometry, which distinguishes threshold between impaired bone and air conduction, and differentiates between sensorineural and labyrinth hearing loss. There are sometimes medical or surgical treatment that can improve the hearing ability for those with conductive hearing loss. Conductive hearing loss caused by wax impaction, foreign objects, abnormal growth, or ear infection can often be corrected with medical treatment like extraction of earwax, antibiotics, corticosteroid, surgical procedures like laser stapectomy or stapedectomy, which are two variations of surgery done for otosclerosis. Next, we have also the tympanoplasty that typically requires a graft of your own tissues. The patch usually taken from behind the ear, leaving a small scar, and usually repair the eardrum.
Sensorineural hearing loss is a pathological process of the inner ear or the sensory fibers that lead to the cerebral cortex. It is often permanent. Measures must be taken to reduce damage and to amplify sound to improve hearing. Symptoms of sensorineural hearing loss include trouble following group conversations, muffled conversation sounds, inability to hear well when there's background noise, difficulty hearing high-pitched sounds, dizziness, balance problems, and tinnitus. Causes of sensorineural hearing loss include damage to the inner ear structures, damage to cranial nerve 8, prolonged exposure to loud noises, medications, trauma, inherited disorders, metabolic and circulatory disorders, infections, surgery, Meniere's syndrome, diabetes mellitus, and myxedema. Treatments for sensorineural hearing loss include corticosteroids. This drug may be used to reduce the cochlear hair cell swelling and inflammation after exposure to loud noises. Next is hearing aids. These can help most people with mild to moderate sensorineural hearing loss in both ears. An ENT specialist diagnoses sensorineural hearing loss. They may do this through mirror examinations. This is initially performed on both ears to exclude causes originating in the external ear canal. Further diagnostics include a hearing test, also known as audiometry. In this exam, vibrational ability of the eardrums and ossicles are examined. Pure tone audiometry examines the patient's tone perception. Tones of varying frequency and increasing volume are then presented to the patient via headphones. Other important tests include the Weber test and the Rhines test. Bone and air conduction is tested during these two exams. Acoussis is a type of hearing loss that gradually occurs in most people as they grow older. It leads to the degeneration or atrophy of ganglion cells in the cochlea and a loss of elasticity in the basilar membranes. It is a type of sensorineural hearing loss. Causes of presbycusis include aging process, exposure to noises, loss of hair cells in the inner ear, various health conditions, and certain medications. Symptoms of presbycusis include the speech of others seeming mumbled or slurred, high-pitched sounds being hard to hear or tell apart, conversations being difficult to understand, especially with background noise, a man's voice being easier to hear than a woman's because of pitch differences, certain sounds seeming annoying or overly loud, and tinnitus. There are two ways to diagnose sensorineural presbycusis. Your healthcare provider will use an otoscope to check in the outer ear canal and look for damage to the eardrum, blockage of ear canal from foreign objects, or inflammation and infection. The second diagnostic test is an audiogram. It is a test in which sounds are played through headphones to one ear at a time. You will be asked to respond if you can hear each sound. If a person can't hear certain tones, this suggests there has been some degree of hearing loss.
What are the different types of color blindness? Sorry.